Okay, I think we're live. Let me just refresh the page. Yeah, okay, so yeah, hello everybody. This is the London Autism Group Charities live stream, and today we're going to be talking about MRIs and how, you know, we can try and make the whole MRI experience and process as accessible as possible to the autistic population. And I'm really, really delighted that we've got with us here two experts in the area, maybe the experts in the topic of making MRIs more autistically accessible. So specifically, Dr. Christina Malamateniou, I should pronounce that better given my Greek heritage, and Nikos Stogiannos, which I think I might have pronounced a little bit more effectively. And you're both from City University, that's right, isn't it? Yeah.
That's correct.
Well, welcome to the live stream.
Thank you very much. Thanks very much to Chris and James for inviting us tonight. And thank you to the London Autism Group charity for supporting the study from the beginning. And also many thanks to the individual people of the charity, the parents, the service users, autistic service users, who have helped us gather the required data to be able to present to you tonight some of the findings and discuss with you about these findings.
Yeah, really excited to hear about the progress you guys have made in your research and the findings. And yeah, thank you so much, Christina. And thanks again to you also, Nikos. You're one of Christina's researchers, right?
Yes, I am a research assistant for this project at City.
So Christine is the boss.
Yes, of course.
Okay, be careful, you know, what you're saying, you know, she's watching. Don't worry. I'll protect you, Nikos.
We work very closely together. It's a very good partnership, and Nikos still works clinically in MRI. I now work in the last 4 years after nearly 15 years working clinically as a research radiographer. So now I'm purely academic, but Nikos has the touch with the clinical MRI still, and he's currently working also as a research assistant with us at City University of London.
Amazing. Good stuff.
It's also a very big team of people behind that. So we have had many people coming into the project from either a medical imaging perspective. We also had autistic service users as consultants to the project for the design of it. And we try to present in different audiences and groups to get feedback throughout its design and implementation and data collection, and then as we write it up.
Awesome. So can't wait to listen to hear more all about it. But also we've got here James Gordon as well. How you doing, James? And also Daryl there, I see. How are you guys?
Hi guys. Hi.
Yeah, how are you doing today?
We're good. Yeah, we're very interested in this. So
yeah. So as I said, we're going to be talking about MRIs. So Christina and Nikos, would you mind just beginning to explain, perhaps, you know, why should we care about this area? You know, obviously it seems pretty clear to me and James, but just to spell it out maybe to those maybe who haven't thought about it that much before or haven't encountered it, although I'm sure most people have. But yeah, why is this an important area of research and an important topic for the autistic community in particular?
Thanks for the question, Chris. First of all, it is well known that accessibility to different healthcare services is problematic and challenging for autistic people. And in particular, different areas, but we focused on MRI because it can be quite a challenging examination, but also a very useful one for many reasons. At least once in our lifetime, we will get an MRI scan for different reasons. And autistic people might get one as the general population, like for instance, for consistent or persistent headaches, for low back pain, for any accident or injury or fall. So this is something like, you know, it can happen to absolutely everyone, and something people might have to experience an MRI scan at some point. Furthermore, for the autistic individuals, the higher incidence of epilepsy, and also very often the very intense research in the area of autism to try and understand its anatomical and functional correlates in terms of the central nervous system and brain, they bring autistic people to the MRI scanner quite often. The adults more so than children in general for the other reasons, but for research reasons, probably the children can have an equal participation in research as adults. So this would have been really much easier if it wasn't for all the challenges that MRI can bring for a person who has to undertake an MRI scan. And unfortunately, all these challenges are even more problematic for people who might face heightened anxiety and sensory sensitivities of any form, either visual, acoustic, touch, smell. So MRI scanning can be quite challenging for autistic individuals because of these reasons. It happens in a MRI scanning normally happens in an isolated room. Sorry, Chris, you wanted to say?
No, you're just breaking up there a little bit, Christina. At least I think I think you were. It wasn't. Or maybe it was my side. Was it James and Nikos? Was that Christina breaking up?
Yeah, it was.
Yes.
Yeah, a little bit. Okay.
I'm going to move location then and go somewhere else. Hopefully the connection is a bit better. Sorry, I'm just going to do that now.
Okay. Okay. No problem. No problem. So, I mean, obviously MRIs. So Christina mentioned there that it's particularly difficult for people with heightened anxiety, just generally. And of course, anxiety among the autistic population is already disproportionately higher than the general population. So it's really, really tough. If you've got the prospect of an MRI coming up, or you've been invited for an MRI, you need an MRI. I totally agree that that's going to be, really, really tough for those people with a raised anxiety. But, even if you don't have raised anxiety, I'm sure this would create significant raised anxiety in itself, right? So, it's a sort of anxiety maker of itself. So, really, really tough I think it's a tough thing for most people, let alone autistic people with raised anxiety and sensory issues and so forth. What do the stats? Do you know what the stats say with regard to, the use of MRIs amongst the autistic population generally? I mean, do we see, is there a clearly lower number of uptake among the autistic population compared to the general population? Is that data available to us?
I don't think so. The data is available, Chris. I don't know if you can hear me okay now?
Yeah.
Okay. Better than before, hopefully?
Yeah, I think so.
Okay, great.
Yeah.
So I don't think this data is available. I'm going to ask Nikos, who has done all the research and digging through that. And also, Nikos is an expert on anxiety in MRI scanning. So I don't know, Nikos, did we find any data that says how many autistic people might get a scan, or if we know that autistic people might have fewer scans compared to what would be expected from the general population? Do we know anything like that from the things we find?
No, unfortunately, we couldn't find any research with such statistics, but the general statistics say that around 1 million MRI examinations are carried out every year. So, given the heightened need of autistic individuals for MRI scans, I believe that there will be a great proportion of them needing MRI. But we have statistics for claustrophobia among autistic individuals, for example, which is, according to our recent results, 4 times higher compared to neurotypical patients. So this is very important.
So claustrophobia is 4 times, the research saying 4 times a higher rate than non-autistic population. Yeah. Wow,
this is as reported as it was reported by autistic service users.
Mm.
Was reported to be 4 times higher. Yes.
Yeah, and of course that's relevant with MRIs because it's a very claustrophobic experience. So it's a shame that there aren't those statistics, but I think it's pretty obvious that although there is just as much of a need for them as anyone else, probably the uptake is bound to be much lower, right? James, come in, please.
A few points. I suspect that not only is the uptake affected, but also the length of time spent on the actual scan, and the amount of, the number of staff needed and etc. is probably increased quite dramatically as well. Because of the difficulties. I know I've myself am autistic, but I sort of don't have as many difficulties as a lot of people. So, and I think I would struggle to stay still for that amount of time. And for a lot of people, movement and stimming, self-stimulation is their way of coping in stressful situations. So no wonder it's 4 times what you're saying about claustrophobia and all those things. No wonder they've got 4 times the amount of stress than other people. So I just wonder. I'm eager to hear what your answers are. Might be. Because it's such a difficult problem.
Yeah, definitely, James. Definitely, massively difficult problem, and obviously, everybody needs an MRI scan from time to time. I mean, if you're invited to have one, if you need an MRI scan, it's for a good reason, and everybody's going to benefit from an MRI scan. So if it is that there's a group of people in our society that cannot access MRI scans because of their anxiety, because of their claustrophobia, because of their sensory issues, or whatever else, then they are going to be much more likely to, suffer the consequences, unfortunately, of poorer health outcomes. And that is possibly one of the reasons, big contributory factors to why we see, substantially poorer health outcomes and more health inequalities in the autistic population compared to the non-autistic population. There's quite a bit of research that shows that unfortunately, that autistic people tend to die a little bit younger, and they tend to have additional health-related, conditions. And, so this might be a little bit as to why, in a way, they're not getting that preventative scan that they need to allow the clinician to make the right diagnosis. So I think the best solution would be probably, we need to find something like they have in Star Trek, where they have the what do you call it, the tricorder. I don't know if you ever watched Star Trek. I'm a bit of a Trekkie, but there's this thing, where they have this handheld device and they scan. There are no MRIs in the future because it's so invasive. Instead, they use this handheld scanner that does it. Until we've got something like that, which is possible. MRIs are our only option at the moment, as far as I know, to comprehensively assess the body and the issues that it's scanning. So we've established why this is a really important area, and we've established also that it's very likely that autistic people aren't accessing MRIs because of anxiety and everything else. So what have you been doing, guys? I know that you've been doing some really, really groundbreaking research on this. And this is what James and I are really keen, and I'm sure the rest of the community, especially those who participated in your surveys, would be just keen to know what the results say. But maybe before we jump to results, if you just tell us exactly, as sort of in lay terms as possible, what you've done in terms of your research methodologies, and then we'll get into the findings.
So with Nikos, we have been doing some research, which is threefold, just to ensure you can hear me okay still?
Yeah.
Okay, lovely. So the first one, the first thing that Nikos started doing was a systematic review of reasonable adjustments used as described in the literature to make MRI scans more autism friendly. So basically we went through all the published papers that are relevant to that. And Nikos has looked through many different databases to try and see what other people are doing and they're publishing in relation to that. So what are the reasonable adjustments needed to ensure that we can do really autism-friendly, autism-accessible scans without the use of sedation and anesthesia? So basically, we tried to take this out of the equation. The reason for that is MRI remains one of the safest exams because it doesn't have any radiation. And it can yield amazing images, very high resolution, very detailed images of the human body. By adding the parameter of the sedation and anesthesia, we always add some measures, but low, but measured, and not without risk. For some people, yep.
Again, your internet is slightly fragmented. No problem. I think I can translate it. So you're saying that Nikos has first done you've looked at what all the literature says so far with regard to how to make reasonable adjustments for MRIs in the autistic population. Is that right, Nikos?
Yes, we searched all the relevant studies and we found out that some very nice adjustments are often used.
Okay, what kind of adjustments? What kinds of adjustments have you found in the literature?
We found some specific categories. The most important one was communication. And the most widely used adjustments related to communication were pre-visits for familiarization and information to the patients before the examination at the booking time, or detailed communication provided by radiographers before the examination in the MRI room, or the effective communication during the examination, where we found, for example, that some patients would like radiographers to talk to them frequently and some not to talk to them, because this was a factor of anxiety for them. And after the examination, what to expect and all this kind of information. So communication, I think it was the most important factor of all the adjustments.
Was the research that's been done so far all UK based or international or what?
UK based.
UK based. And were they focusing on autistic adults or did it include children as well?
We constructed two separate online surveys, one for autistic adults and one for the parents or carers of autistic children or autistic individuals who cannot consent to the study, or they have some important learning disabilities. So we asked the parents or carers to participate.
Sorry, what I was talking about was in the literature that you've reviewed. Does the literature focus on autistic adults only, or both children and adults? So my question is, with regards to communication and pre-visits, did that work really well for both? Okay, for both. Okay. Well, that isn't a surprise, is it? I don't know what you think, James, but yeah, it's just a standard good practice, isn't it, James? giving the opportunity to improve familiarity, improve predictability, that reduces anxiety. That enables people to have the space to ask questions and feel the environment, not just see it, but feel it, right? And sort of get a test of the sensory inputs they might get. And the style of communication as well, and whatnot. All of that doesn't surprise me. What do you reckon, James? That sounds good, right?
Yeah, it would be. I don't know what the plans are for this research, but it'd be good if it was sort of distributed and viewed widely. But because I think a lot of autistic people that I know have had they find health services in general, it's very patchy and it's a lottery, depending where you go, what staff's understanding of autistic people is, so it may be quite difficult to, depending on which hospital looks at this and takes it up, depends on what the training programs are and this kind of thing. I know that there is a plan to get a kind of uniform NHS training on autism at the moment. So, and there are various organizations among the staff themselves that are sort of helping with this. Like we've already spoken to the neurodivergent nurses group, so maybe they'd be a group that could look at this research as well.
Yeah, they're a sort of neurodivergent workforce of nurses that we could connect you with to try and spread the results and influence change. But that was the results of your literature review. So then you went and did the surveys, right? So what happened with that?
So we did 2 surveys because we wanted to see the problem from the 2 perspectives. Can you hear me okay, Chris, now? Great. When there is an issue, just let me know, just do something so I can pass over to my lovely colleague, Nikos, because his connection seems to be much better than mine. So the 2 surveys, one was about those who are doing the scans, the practitioners, who are called radiographers in the UK. And the surveys were only UK based. The reason for that is because we want to change practice, and practice is more, it's more specific to countries because it relates a lot with training. So and also guidelines, safety guidelines, practice guidelines. So we focus on the UK, having done the systematic review, which was actually worldwide to see what happens in the world. And we asked the radiographers what is their knowledge and skills and training in relation to making MRI scans accessible for autistic individuals, if they have received enough training, if they can recognize an autistic person when they see them, and if they know what they need to do to make the scan accessible. So that was one aspect. Yes? Can you hear me okay, Steve?
Yeah.
Nikos, do you want to add something here in terms of the survey for the radiographers and some of the results we found, particularly as to how much training there is, if there is?
Yes, thank you. I believe the 2 most important findings from this survey.
Sorry, Nikos, how many radiographers did you survey?
We had 128 valid responses.
Wow, fantastic. So this is a big research study. I mean, because there's not that many radiographers around. So 128, it represents a big proportion of so this is probably quite representative of MRI radiographers. So yeah, tell us what you found.
So the key findings, in my opinion, are that first, around 60% of MRI radiographers said that they don't feel confident in recognizing an autistic patient. They cannot confidently recognize a patient with autism. And the second one is that 3 out of 4 radiographers have not received autism-related training. I think these two things are the most important for the survey related to radiographers.
Okay, let's pause there because those are two really important findings. So the first one was 60% of the MRI radiographers stated that they weren't comfortable with knowing how to communicate and practice their practice with the autistic population. Is that right? Did that surprise you?
No.
Yeah, you know, I mean, it should. I suppose it's not a surprise. If anything, I might think it might be a little bit higher than that in reality. I think it could be that some of them might have been. I don't know. That's the problem with research, isn't it? Because I'm a researcher as well. This is always just you're always reliant on what they say. You know, it's not like a blood test. Do you know what I mean? It's a subjective response. So I'd say it's at least 60%. That's the honest group. It's probably more like 80%, isn't it?
Absolutely.
Yeah, especially if. Sorry, go ahead.
Also, those who have answered, they might have had special interest to answer from family or friends having an autistic child. So these people probably, as you say, is at least 60%, because the ones who responded, they said, we don't have any formal training. What we know is from lived experiences, or from our child, or from our nephew, or from our godson. So basically, all the experiences they had were from family. And those who responded, they might have had more experience or exposure to a lived experience of autism, or in their family, in their immediate family, and therefore it's 60%. If this
Wow.
was out to the total sample, the total population of MRI radiographers, I bet this number would have been higher, as you said.
For sure. Yeah. Yeah. So I mean, if so, you're saying that only people you have a feeling that only predominantly the people that took part in your survey, as big as it was, were those kinds of people who had a particular interest in autism because they had a personal connection to it and whatnot, meaning that they probably were in fact slightly more comfortable and aware and knowledgeable compared to those other MRI radiographers that don't have that. So in reality, it's probably more likely to be about 80, 90, maybe even 90%. That's terrible, isn't it? I mean, it's not that surprising, but that's not where we want to be, because the last thing you want is for an autistic person to make all the effort and, despite having the anxiety, to go and access the MRI, and the radiographers very anxious themselves because they're not sure as to what to do and how to communicate, and it doesn't deliver as effective, I'm not sure the effective interaction as they could have, and that's crucial, isn't it? Because if you don't want the autistic person to be thinking afterwards, oh gosh, that was a terrible experience, I'm not coming back. You want it to be, I've tried my best, I've given it a shot, I've gone and done it, and it was a good, positive experience. So you want to grab them and make sure that you don't lose them for the next time, or to spread the word, So that's creating real problems in itself. But I guess it's not that surprising if 3/4 of them said that they didn't have any training. So what kind of training should they have? Looks like, Christina, you've frozen. So I'll take it to you, Nikos. What kind of training should they have?
We asked them what kind of training they would like to have, and I think most of them answered that they would like to have a departmental training and online training related to autism, and also training within the higher education institutions.
But did you say that 3/4 didn't have training? So a quarter said that they did have training. What kind of training did that look like?
Most of them within the department. and not formal training, most of them.
So sort of informal department-based training about just about autism generally, or about the radiography approach to autistic people? Which one?
Yeah. Informal training.
It was mostly general training, Chris, and it was in the type of sort of a webinar or a seminar generically about autism in healthcare, but
Okay.
there's nothing specific out there as we speak, and we looked very thoroughly in relation to medical imaging, and I think that's why it is groundbreaking, because it's very specific. And although we use the principles of inclusivity of autistic individuals in healthcare, the innovation of that project is that actually it touches upon the specifics of medical imaging, and in this case, MRI.
Okay, so the three quarters, so they didn't have any training. The quarter that did get the training probably didn't get very good training. Let's be honest, especially in relation to radiography and MRIs and whatnot. I mean, most of these informal trainings, to James and our experience, they're very, very questionable. You know, sometimes they perpetuate stereotypes. They aren't autistic led. You know, and that training can sometimes just be not really contribute anything that positive. You know, you might get a small amount of something positive out of it. What do you think about all that, James? 60% stated that they weren't comfortable, and 3/4 said they didn't have any training. I mean, this is a mess, isn't it?
Yeah, it's not surprising. I mean, it's probably mirrored in across the NHS in most of the different areas.
Great point. Yeah, this could be mirrored just across the entire service portfolio in a way. Guys, did you see any, were there any kind of predictors? Predictors is a bad word. Were there any, was there anything in the data that suggested that certain types of radiographers were more comfortable than the others? Do you know, was there any kind of variable that suggested it correlated with comfort? Do you know what I mean? Is there a type of radiographer out there that you could see who is a little bit more comfortable and confident?
We didn't find anything. I guess your question is about male, female, or years of experience.
Right.
Nikos, I don't think we found any significant correlations, but you can confirm that. But what was evident, Chris, was that, and James, was that those who have had experiences, like lived experiences, they were probably better prepared and more thoughtful in arranging and planning a scan. The problem was that, I mean, as you say, many of them did not have the training, but they had, and this is the positive, they had all the appetite and intention to be trained if someone organizes training for them. So basically, because we are a health and caring profession, we want to help others. We want to help our patients. So if someone puts something nice together, and for me, what can be really transformative is either simulation, role play, meet autistic people. There's nothing more beautiful than actually meet an autistic person, and then this is going to stop all the preconceptions someone might have in their mind and understand that things might be different, but they're actually much simpler to organize if you have met someone. So I think all of them said that they would be very willing, and actually, Nikos, please correct me if I'm wrong. They all said, thank you for doing this research. We understand the gaps in clinical practice, but thank you very much. And please, if there is any training in the comments at the end, please let us know. So I don't know if there would be scope for us to discuss things with you in the charity, if some kind of training could be organized and designed, delivered, and of course we can discuss all the practicalities, and people can add comments and say how things might be better from their experiences.
Sure, for sure. We'd be really keen to support you with that. So thanks for that, Christina. I mean, the fact that they're really keen, obviously, that doesn't surprise me. Obviously, they're healthcare professionals that they've got caring in their core. Most people do. Most professionals do anyway. Healthcare professionals. So that just makes it sadder, though, isn't it? That there's this need and desire, but a massive gap in competency and this big sort of anxiety among the population, which is a real shame. If there's a hunger to learn and to want to do better. My last question about this is: were any of the participants themselves neurodivergent, autistic? Were any of the radiographers, and what proportion of them were autistic? Did you look at that?
Nikos, we asked about autism in the second survey. I don't think we asked about autism in the first. Is that correct?
Yes, it is. But we had one response from a radiographer who told us that he's also autistic.
Okay, so one self-declared.
Yes, one.
Mm.
Mm-hmm.
Okay, James.
I might question, their willingness to admit to that kind of thing, because I've done a little bit of quite a lot of research myself generally about professionals, not just in the NHS, but just in society, in the public services, in education, across the board, really. And I've come across people online, and all of them, 90% of them have got anonymous social media handles where they express their views on there. They'll call themselves the neurodivergent teacher, or this, that, and the other. But they're all unanimous in saying they can't possibly come out in their profession, or it would go against them, in their future job prospects and things like that, because the education about autism just isn't there.
That's really interesting, James. And that reflects what we've seen in the charity, with regard to a fear of disclosure. It could sort of, I mean, if you think about it, if so little training and so little awareness and knowledge is located in the radiography community, then there isn't much. It's not much of a stretch to think, well, if I'm an autistic radiographer, I don't think my community understands autism very well. Why should I risk disclosure? And that's a real problem, because I think probably one of the better ways to learn and improve the knowledge and understanding and do the training is to have the autistic radiographers at the head of it, leading. But if they're hiding or scared to disclose, which is totally reasonable, that we're kind of missing that opportunity. So yeah, I totally agree with you there, James. Any thoughts on that, Nikos or Christina?
Nikos, would you like to go first? Because this lack of empowerment and unwillingness to reveal an autism diagnosis, we found it in the second survey. So Nikos might want to touch upon, and I'm very happy to fill up afterwards.
Yes, thank you. First of all, I would like to tell that one of the most important things reported by radiographers was that we would like the autistic patients to communicate their needs with us. Because if radiographers are not aware of a condition like that, they cannot provide the optimal care they would like to provide, and make all the reasonable adjustments prior to the examination. So the MRI examination would not go smoothly, And second, on the other survey to autistic individuals, many of them said that no, I didn't tell them at the department that I am autistic. I think it's very important.
And also, many of them did not feel empowered to do so, to disclose it. So it's not just not willing, not feeling empowered. So the system was broken along the way. Their GP, perhaps, or their referring consultant did not communicate that to the MRI scanning center. They were not asked explicitly at the booking. They were not asked when they came to the center. So there were many missed opportunities to ask them and enable them to say something. Also, perhaps we're doing all the screening in the wrong way in MRI. So perhaps this would have been one of the questions. Are you autistic? Please tick this box so we can make all the adjustments needed. So just to treat it in a very inclusive, very positive way to enable them to say that, because many people felt, I mean, some of the notes they have been writing, I just felt, you know, all the things we're doing in MRI practice could be improved. They said, I'm so happy you're doing this research because I thought no one would ever ask. I'm so happy that someone is looking into that because my son had a terrible MRI experience and this has to be better. And as you said, Chris, if the first MRI experience is very bad, then this can propagate further trauma for the person and the family and the carer and the siblings. So people might feel MRI scanning is awful, whereas with appropriate adjustments and careful and thoughtful changes to the routines, it can be really a very smooth experience. And I'm sure Nikos would like, when we're given the opportunity tonight, to say some of the things we found beyond communication that work, like the scan duration, like
Oh, Christina, we're losing you again, unfortunately.
and like many
Nikos, would you like to pick up?
Nikos can present. I will pass on to Nikos.
Okay, thank you. So,
Sorry, Nikos, before you tell us, just to clarify, just so it's clear to the listeners, you're now talking about the survey of the parents and families, right? And tell us a little bit about how many people participated in that.
yes, we had 112
112.
autistic adults, 112, and 16 parents and carers of autistic individuals.
Oh, okay. So predominantly, this is a autistic population that you surveyed, and some parents of children. Okay.
Yes.
Okay. Yeah. Go ahead and tell us some of the main results. That'd be great. Yeah. Thank you.
Mm-hmm. So we asked autistic service users to tell us, apart from their overall MRI experience and all their comments, to identify the top challenges when undergoing MRI examinations, and also the enable of MRI scanning. So they answered that inadequate information received before the examination was a major challenge for them. They would like more information before the examination. Also, in many cases, the loud acoustic noise exhibited by the MRI scanner during the scan was reported to be very annoying, and it was not a surprise. Also, not enough time allocated by MRI radiographers, so autistic patients would like more time to familiarize with the MRI unit environment, to ask questions, all of this. And also physical issues, physical comfort issues inside the scanner. Due to the narrow structure of the magnet board, and they feel claustrophobia in many cases, and the physical discomfort. These were the major challenges as identified by autistic service users.
So just to summarize, the autistic survey participants stated that they don't get enough information beforehand. There's too much. They've experienced too much noise during the MRI, or they anticipate lots of noise, or both.
No, they experience too much noise.
Yeah. They felt that they don't have enough time. It all felt rushed, and then finally they've experienced a lot of physical discomfort and claustrophobia. Yeah, so very challenge. Those are the main challenging experiences that you had.
Yes.
What were the enablers? What were the good? What was the good stuff?
So the good stuff. So they suggested that we have to use better headphones, for example, soundproofing headphones, because better acoustic noise cancellation, it is desirable. Also, wearing comfortable clothes when coming to the MRI department, so they don't have to change their clothes. They can go inside the scanner as they are, and also less time for the pre-MRI screening questionnaire. You know, so it's easier both for radiographers and for patients. And also, they encourage the autistic service users to ask a lot of questions. These were the most important things. And also, they would like to have a quiet area after the examination to relax, which was not provided in most cases, a quiet area to relax after the scan. Another important thing.
Okay.
And
So
it's important because some of them might have driven to the MRI department themselves, and if they felt quite drained after the MRI scan, so they would need some area to unwind, relax after that experience, and then be able to go back home in any way, either in the public transport or with family or even with themselves driving. So I guess this shows that in many different ways, in terms of the pre-scanning, during the scan, and after the scan, we have failed to provide minimum adjustments to make it inclusive.
yeah, that's. I mean, I suppose all your results aren't that surprising, but they're really useful, aren't they? I mean, they're clear evidence of what the challenges are, and what some of the things that are being called for to improve it. So they're asking for headphones or noise cancelling headphones to be provided, I suppose, on site, or for it to be for them to be allowed to bring it, or to be, I suppose, indicated that if they have them, they're welcome to bring them. I suppose all of those, right?
Not all headphones can go into the MRI scanner because the MRI scanner is a huge magnet. So anything
Good point.
So they have to be screened. So in the MRI scanners, we have specific headphones, which are called pneumatic headphones. And these are working by the type of air that is not allowed to circulate in this air to minimize noise. However, the pneumatic headphones don't work. And we have seen that from our experiences as radiographers, as scanned volunteers for research studies in MRI. So they're really suboptimal, and there's a great need for the industry, for service users to work together and make better headphones for MRI that are MRI safe and MRI compatible.
Wow, that seems really, really important. Really important. So that's definitely something we need to push for the industry to fix. Um, so letting them know that they can wear comfortable clothes, which they don't have to change. Because I suppose that awareness that they're going to have to change into the gown, that can be quite anxiety provoking. Less time during the pre-screening questionnaire process, more time to ask questions in the quiet area. I suppose the good thing from my perspective is that a lot of these things are doable, except for the headphones. I mean, that will take a lot of time. But I mean, securing a quiet area, providing more time, allowing them to wear comfortable clothes. These are definitely what you would call reasonable adjustments, and very doable. What do you think, James?
Yep. It's all quite. It sounds quite logical that people would ask for those, especially the place to recover afterwards. I think I've known a few people that have sort of had to be pushed out, you know, because they were running over time. And you know, it's an incredibly stressful experience, and then they've got to go through most people have got to go through a stressful experience getting home on public transport. So yeah, that's definitely a big one. Otherwise, you know, there's going to be there might be like a build-up of stress, and then they might melt down or something like that, you know, and nobody wants that, you know.
Did anyone say that they tried to do it but they just couldn't cope and exited? And what proportion of people said that?
Yes, many of them. Mhm.
It's really, really sad, isn't it? Really bad. Yeah.
And if I can add to that, Chris, this was going to be one of the closing remarks. What was really shocking is the amount of people who approached us on social media and they said, I really need to have an MRI scan, but I am not going anywhere near it. So I choose to live with chronic pain. One of those had tinnitus, and the other one had musculoskeletal issues and low back pain. Another person had persistent headache. So 3 people at least I can recall, because this was not part of the survey. There were other users, service users, who felt the need to contact me, and they said, I'm really sorry, I cannot fill in your survey because I haven't had the MRI scan. I just want to tell you, I feel it's an awful examination and it has to change so I can get a diagnosis and I can get some treatment, because now I live with chronic pain.
I mean, yeah, I mean, that just sort of summarizes probably the reality for so many autistic people, you know, and not even just autistic people. There's probably loads of non-autistic people that suffer from some immense anxiety and other issues that relate to this. But yeah, that's really sad, and it goes back to what we were talking about earlier about, you know, this isn't just an inconvenience. This is something that is going to have a real life-changing impact on people. You know, I mean, if you can't get an MRI and you can't get diagnosis, you can't get the treatment. So this is life-changing stuff. Yeah, James.
And yeah, I mean, I've heard a lot of things. It feeds into more general things I've heard across autistic people accessing the NHS. A lot of people accessing GPs even, and professionals, you know, approach to autistic people and this kind of thing. So if an autistic person has a bad experience with a professional, they'll put something off, you know, and they won't go for that test. They won't even bring up the topic, if you know, but they know there might be a risk of them, whatever the illness is, that they'll know that there's a high risk of them getting ill. They might see signs, symptoms, but they'll be put off by the professional, or you know, there'll be some kind of barrier in the way from the lack of training or the bad training that exists at the moment. So it's really important that we get you know, this particular area of research sorted out, and all the other ones, you know, as well.
Yes, Christina.
One of the autistic individuals who could not get the MRI scan because of all these challenges told me that they felt trapped in the system because they couldn't even speak with someone via a chat. There isn't a chat service to speak with someone because they don't like talking on the phone. So they don't like calling to ask for information. They prefer a chat service. So I tried to help them, and I tried to go to their local GP service or a GP service and try and see, or even the NHS service, and see if there is a chat. There's not a chat option. You have to physically call and speak with someone to try and arrange some consultation or discuss with someone. So starting from that, starting from their accessibility to information at the beginning, we are all wrong. So I feel that there are so many easy changes to make, not necessarily very costly, but can make a huge difference to many people, uh, and save lives. Because if someone lives with chronic pain, uh, and also the anxiety of experiencing the chronic pain, the lack of sleep because of the pain, it's just awful. They don't get what they need, and this is scandalous because we live in the 21st century, and we cannot provide basics to all people who might fall ill or be unwell. I just find it scandalous, to be honest.
Yeah, totally agree, Christina. Totally agree. So, were there any other key findings that you wanted to highlight to us now before we move on to like what's next? Because that's the thing I'm wondering about. Where do we go next with these findings? What would you like to see happen? But first, are there any other findings that be useful to hear about? Maybe from the
Nikos?
parents of the children. Maybe I was wondering when you were talking earlier, was there maybe like a particular story from one of the autistic children that stood out, something like that was quite powerful and resonated
Yes,
with you?
qualitative data is still under analysis. So these are only some preliminary results.
Sorry,
But
Nikos, just to say, by just for our listeners, what Nikos has been talking about are interviews, some one-to-one interviews. Just to clarify, because I don't know if everybody will understand the technical jargon of quantitative and quantitative. But so we're talking about, so you've gone and spoken one-on-one with individuals about this and had in-depth conversations, and you're analyzing those conversations, right?
no, we wish we could. No, we wish we could do this, but unfortunately, due to the pandemic, we couldn't do that, and we changed the research design. So when I say qualitative data under analysis, I mean that autistic service users were encouraged to write their comments and their suggestions to make MRI better for them.
Okay.
So we have, I have some extreme data, Dr. Malamateniou, many pages, and we have to analyze this to make some results.
Wow.
Yeah.
Okay. So there isn't anything you can tell us from that just yet, is there? About any particular experiences, Christina?
I remember one story, the mom of a child who went for an MRI scan. Can you hear me okay, Chris? Yeah. So they went for an MRI scan. There was not a proper assessment. The child was 7 years old, not a proper assessment of the child's preferences and needs. The child went into the MRI scanner, but became increasingly distressed, and both parents had to physically restrain the child in the scanner. It was awful, awful, awful. And she was very emotional. She was writing that had we known, we would have requested sedation or anesthesia, because obviously for this case, it would work better and we wouldn't traumatize our son because of that. And now she says that the boy cannot even walk outside the hospital without feeling traumatized and remembering that situation. And also she said that even for a minor thing like, I don't know, a chest x-ray, he would go into meltdown because of that experience, because he recalls the experience and he just totally relates that to the hospital environment. So I think this is one case, but I'm sure there are many other there. And I'm very grateful. We are very grateful with Nikos and the team for the parents and the autistic users who sat down to fill in the survey at a time that the pandemic was raging. And obviously they had many other priorities like physical and mental health, employment, homeschooling. So I just want to say we are hugely grateful to them for providing this information to us to use as pilot data for the future.
That's kind of you to say, and I mean I agree. It's really fantastic of the community to support the study, but I'm sure they all did it because they recognise how crucially valuable doing so would be. You know, this is a massively under-researched area. We don't have much evidence, yet it is a one of crucial importance. The story you told us about this child who, you know, has essentially experienced trauma as a result of his experience with MRIs. That's terrible. It's so sad, and um, you know, the fact that you know it's carried over into his daily life to the extent he can't go near a hospital or can't. I mean that will have unfortunately tremendous impact and repercussions for his well-being. You know, for whatever reason he needs to go to a hospital or get seen by a medical practitioner, anything whatsoever that reminds him of that experience. You know, he's going to push back on, and that was all very preventable, you know. So it's so sad, it's so sad, and it's probably true, that is probably true for many others as well. So for sure this needs to change because that's just unacceptable. So the question is, how are we going to change this, Christina and Nikos? Where would you like to, where are we seeing this go? Where do your findings go next? And you know, what would you like to see happen to create the change?
These were both pilot studies, the surveys, and in particular, the second one with the autistic service users. We had responses from people across the UK that were examined for different clinical concerns at different anatomical areas and in different MRI scanners. So we would like to see if the things we learned can be applicable in a standardized environment to try and gain understanding about how we can create recommendations for practice, clinical practice, and also create educational provisions for radiographers so things like the ones people have experienced, autistic individuals, will not be repeated in the future. So to ensure that we educate the workforce and also we provide either the software, hardware, or behaviors that will allow a truly autism-friendly MRI service for adults and children.
Yeah, and Nikos, anything to add?
Yes, thank you. I totally agree with Dr. Malamateniou. We have to closely work, for example, with the industry to make MRI scanners friendlier, to reduce the acoustic noise, to reduce scan duration. But we have to know that anything nothing can substitute the human communication. So the communication between radiographers and the patients, I think, is the most important thing. So training radiographers would be the most beneficial thing, I think. Mm-hmm.
Yeah, agree. But I think you know how you train them is also really crucial, right? That's really crucial. And to Christina, what you were saying about you know making real change, it sounds to me that we're going to need to have some measures in place so that we know it. You know, it's one thing sort of thinking, yeah, these changes should make a difference, but it'd be nice to have the evidence. Do you know what I mean? So if it's something that we can measure in some way, in a routine way, just so that we know, because it's always useful to keep hearing. You know, we don't want to stop hearing from these families. You know, even if it's going well, we want to document why and learn more. And I think the learning has to always continue, probably.
Absolutely.
James, any other final thoughts from you, James?
Well, I haven't mentioned, but I've got a son who went for an MRI quite some time ago now. I think it's maybe 8 or 9 years ago. And so he was about 5 years old. So by that time, I was lucky enough that he'd had all his diagnosis, and we're probably one of the lucky ones that, because of the level severity of his learning disabilities and that kind of thing, and the number of diagnoses that he was going in to check up for epilepsy, which he's had on a number of occasions. He's still got epilepsy now. So because of the level of concern, there was a lot of attention from staff. They basically gave him general anesthetics straight away. We weren't made to wait, and it was all very efficient. And we got a lot of attention, even from one of the consultants and people like that. So I'm one of the very few lucky ones, I think, but that's only due to sort of levels of concern about around all my son's different diagnoses. You know. So what I'm saying is they can get it right as well, but the resources need to be allocated in this kind of thing.
Thanks, James. Christina.
This is a very important comment that James made. We should not forget that in the service where the radiographers are actually doing their job very well, and the service works well for the autistic service users, particularly for children. Particularly adults, what we find for the adults is that the adult services for autistic service users, it's like they fall off after 18 years of age. So for the children, there are much better provisions. And for the adults, the services really deteriorate once they leave the pediatric pathway after 18 years. Yeah.
Sorry, can I just add? There's a reason for that. Clearly, that most of the emphasis is put on to early interventions and this kind of thing, and all the kind of support that we've seen organisations and the government and councils, local authorities, they put all the support into the early years and the children, and then as children grow up, it's as if suddenly autism no longer exists. So by the time you're getting to the age of 18 and into the 20s, they leave school. There is no other special provision, basically no support. It's just left to a few charities and local organizations to pick up the slack. There is, or local college or something, but basically all the support goes away, the government funds goes away, benefits very scarce, so this is a reflection of that, and there needs to be a focus. That's kind of why we are focusing in our charity, the London Autism Group charity, on we want to see support provided throughout someone's life at the same level, an autistic person's life, because autistic adults do exist, and they're very vocal now because of social media and because of the internet, where they were unknown 20 years ago. So this is a very, very important point that you've made, Christina. Yeah, so just wanted to say that.
Thanks, James. Thanks very much. Well, has anyone got any sort of final things that they'd like to add, or anything like that? I feel like we've covered things quite well. It's been great to hear about all of your results and discuss all the issues. It's so important. But yeah, is there anything else to add by anyone? Christina.
Again, just to reiterate that a huge thank you to the people who have participated during the pandemic in the studies. And we promise that we would like to be back with more results from a larger scale study in the future. We are applying now for funding, and we are hoping to apply for funding in January 2022 in NIHR. And I know, Chris, I hope you would be part of that and help us through the application. So hopefully we can come back with more results and hopefully more graspable results on the practice recommendation.
Thank you, Christina. That's great. Nikos, any final thoughts or comments from yourself?
No, I don't have any final comments on this.
Okay, well, thank you so much to both of you for your time this evening, and more importantly, the work that you're doing. I know that you know this, but I still want to say it is truly groundbreaking and absolutely crucial for the autistic population. So yeah, I wish you really well with it all, and yeah, charity will definitely be here to support you with it all as much as we can. And Christina, I'm delighted, obviously, to support the research as well. James, any final thoughts?
Just to say, echo those words. Really, thank you so much, both of you. This is so important, and I think this work, I hope, is replicated in a lot of other different fields within the NHS and beyond. Because professional autism training and that kind of thing is so important.
Yeah,
so thank you.
I fully agree, James. This could serve as a template, for what can be done. This could be a model template for how other services can change and aspire to be better. So this could have far-reaching implications beyond just radiography. So fully agree. Yeah. Christina?
Chris, you said you had some nurses who are doing something similar. If we can be put in touch with them, or if there's another network.
For sure, we'll do that. Yeah, for sure. Okay, so thank you very much. I'm going to end the live stream. If you wouldn't mind just hanging on there once I press the end button. But yeah, thank you so much, and all the best.
Thank you, and thanks, James.
Thank you very much.
And Chris. Nice meeting you all.